Hi, I'm Mary Francine Fabricante from BSN1E, and for today's video, I'll be running a return demonstration about transferring patients between bed and wheelchair. The purpose of this is that a client may need to be transferred between the bed and the wheelchair, or a chair, the bed and the commode, or a wheelchair and the toilet. There are numerous variations in the technique. Which variations the nurse selects depends on the factors related to the client, the environment, and the healthcare provider that are assessed prior to beginning the transfer. Number 1. Assessment. Before transferring the client, assess the following: the client's body size, the client's ability to follow instructions, the client's activity tolerance, the client's muscle strength, the client's joint mobility, presence of paralysis, the client's level of comfort, presence of orthostatic hypotension, the technique with which the client is familiar, the space in which the transfer is maneuvered, the number of assistants needed to accomplish the transfer safely, and the skills and strength of the nurse. Number 2, planning. Implement pain relief measures so that they will be effective when the transfer begins. Number 3, assemble the equipment and supplies needed, such as robe or appropriate clothing, slippers or shoes with non-skid soles, transfer walking belt, chair, commode, wheelchair or stretcher as appropriate to the client's need. And lastly, sliding board if it's available. Number 4, remove any obstacle from the area used for the transfer. Now let's proceed with the procedure. Number 1, introduce yourself and verify the client's identity. Explain to the client what you are going to do, why is it necessary, and how the client can cooperate. Hi ma'am, I'm Mary Francine Fabricante from CSPC. I'll be your student nurse for today. May I know your name?
I'm Georgia Cessna M. Gumba.
And your birthday?
My birth date is October 18, 2002.
Okay, Ma'am Cessna. Today, I'll be transferring you from bed to wheelchair. Is that okay with you po?
Yes po.
Okay, Ma'am Cessna. You can cooperate with me by following the instructions that I'll be telling you to do. Is that clear po?
Yes po.
And answer my questions honestly. Okay, ma'am?
Yes po.
Okay. Number 2, perform hand hygiene and observe other appropriate infection control procedure. But since I've already washed my hands, I will now sanitize it with alcohol. Number 3, provide client's privacy. It's important to provide the client's privacy by closing the curtain around the bed or closing the doors. Number 4, position the equipment appropriately. Place the wheelchair parallel to the bed, as close to the bed as possible. Put the wheelchair on the side of the bed that allows the client to move towards stronger side. Lock the wheels of the wheelchair and raise the footplate. Number 5, prepare and assess the client. Assist the client to a sitting position on the side of the bed. Then assist the client in putting on a bathrobe and non-skid slippers on shoes. Put your hands on your chest, and now I'll be putting my left hand under your shoulder and my right hand under your knees. On the count of 3, I would like you to help me And I'll be putting you on a sitting position. 1, 2, 3. Now, ma'am, can you please move forward on the edge of the bed? Number 6, give explicit instructions to the client. Ask the client to move forward and sit on the edge of the bed. Lean forward slightly from the hips. Place the foot of the stronger leg beneath the edge of the bed and put the other foot forward. Place the client hand on the bed surface or on your shoulders so that the client can push while standing. Now, ma'am, I want you to put your hands on my shoulder. Okay. Wait. Number 7, position yourself correctly. Stand directly in front of the client. Lean your trunk forward from the hips. Flex your hips, knees, and ankles. And then assume a broad stance, placing one foot forward and one back. Mirror the placement of the client's feet if possible. On the count of 3, ma'am, I would like you to stand. 1, 2, 3. Together, assist the client to stand and move towards the wheelchair. Number 9, assist the client to sit. Ma'am, can you please put your hands and arms on the arms of the wheelchair? 1, 2, 3. 1, 2, 3. Number 10, ensure the client's safety. Ma'am, can you please push yourself back on the wheelchair? And lastly, lower the foot plate and place the client's feet on them. Thank you.